The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome, TMD Warriors. We are gathered here for the next episode of TMD Demystified. I am Tony Urbanic. Today, the topic is the actual definition of TMD. What is the definition of TMD? Let's pick a title for this. Let's call it Definition of TMD equals Inflammation of the temporomandibular joint. TMD equals inflammation of the temporomandibular joint. That is a good working definition for TMD. I'm going to go on to explain the irrationality. First, let's start with the rationality. The rationality of that decision, the rationality of that definition is very simple, that inflammation, as I've talked about many, many times, inflammation of these joints, no matter how much damage is done, no matter what other associated symptoms are there, inflammation of the temporomandibular joint creates all of the symptoms. So if you can, one way or another, make the inflammation go away, then the symptoms will go away. And that's the simplicity of the Urbanic device and protocol. You unload the temporomandibular joint long enough, according to a not too lengthy protocol of unloading the joint, bilaterally, and the symptoms will begin to diminish and go away. That's a very simple concept. It's very rational. And that is a comparison to the very irrational treatments. And that's the direction we're going to go today. The irrational treatments that are proposed and used by the dental profession and other parts of the medical establishment for treating these very common and not unusual symptoms around the head and neck, which are now most commonly described as temporomandibular joint dysfunction. So in the process of treating temporomandibular joint problems, it appears to me that the profession over the past 40 years has digressed into actually treating the symptoms and not the cause. If the cause of temporomandibular joint symptoms is derived 100% from inflammation within the temporomandibular joint, why in the heck would anybody just want to treat the symptoms? Now let's compare this to other parts of well-known parts and well-known aspects of medical treatment that is very rational in treating a disease. And then we'll compare that to the irrational treatment of TMD over the past 60 plus years. So I picked out a couple very common diseases that are rationally treated. The first one would be diabetes. Diabetes begins with the destruction of the islets of Langerhans in the pancreas, which secretes insulin. And we're all very familiar with the treatment of diabetes type 1, which is the treatment with insulin on a routine basis. But the symptoms of diabetes would include and do include frequent and increased urination, excessive thirst, increased hunger, decreased weight, blurry vision, tingling of the hands and feet, very tired at inappropriate times, and very dry skin. Now, those are the well-known symptoms of diabetes. Now, the medical profession has learned its lesson long time ago that they don't go on and treat any or all of these symptoms when the diagnosis of diabetes is made. Now, you can treat those symptoms sometimes very simply, which would handle the immediate problem. For example, if you have increased hunger, you'll eat a lot. And on the other hand, on occasion, patients have a decreased weight loss, increased weight loss, and inappropriate without even trying. Blurred vision. Patients can end up going to the ophthalmologist or optometrist and get new glasses, but the symptom does not go away. The symptoms recur. And so once the diagnosis is made of diabetes, then they treat the actual problem by supplementing insulin. Very simple, very rational. Another good example would be pancreatitis. The symptoms of pancreatitis are noteworthy in causing, as you probably well know, severe belly pain, and which spreads to the upper back, nausea, vomiting, rapid heart rate, fever, swelling of the upper belly, and decreased blood pressure. Now, each one of those symptoms can be treated individually. If the diagnosis of pancreatitis is not made, then you can spend and waste a lot of time treating each and every one of those symptoms in different manner, multiple manners to treat nausea, multiple and vomiting, multiple ways to decrease a rapid heart rate, confuse it with other problems like VFib and a heart attack. Or a fever, and trying to treat it with antibiotics. But the treatment of pancreatitis is simply rest and change of diet. And over a period of time, the inflammation, because pancreatitis is nothing more than inflammation within the pancreas, the inflammation decreases and the symptoms go down. Very similar to what I'm speaking about, and that is inflammation of these joints create the symptoms. Inflammation of the pancreas creates those symptoms, and inflammation which destroys the islets of Langerhans in the pancreas will create diabetes. But you don't go on and treat all of the symptoms individually because it'll take you nowhere. Well, as it works out, that's the standard of care in the United States of America and around the world regarding treatment of TMD, even when it is diagnosed correctly. And then the problem of this problem, TMD, being misdiagnosed constantly by the medical establishment and confusing it with migraine headaches, earaches, and Meniere's disease, and various kinds of problems with tingling and numbness of the arm and fingers, which is misdiagnosed constantly. So there's the problem of misdiagnosis of TMD, but even when it's diagnosed correctly, then the dental establishment, if it's diagnosed and sent to a dentist, will use drugs. They'll use psychiatric drugs, opioids, muscle relaxants. Of course, as an oral and maxillofacial surgeon myself, I was definitely caught up on the surgical intervention of temporomandibular joint problems in bringing the meniscus into proper relationship or removing the meniscus, various kinds, irrigating the joint, None of these actually address the problem of TMD, which is inflammatory destruction of the temporomandibular joint. And the best way to address that is to unload the joint, allowing the inflammation to decrease. Once the damage is done within the temporomandibular joint, you get bone loss, you get meniscus dislocation, you get various kinds of fluid changes of the synovial fluid. Once those things happen, there's really no going back once you actually have the damage. But even in a very damaged joint, by unloading the joint, you will decrease the inflammation, just like a set of crutches would unload a bad knee, an inflamed knee. And if you're able to stay on the crutches adequately, the inflammation within the knee will decrease, and the symptoms, in this case, pain in the knee, will go away. That is rational thought. That is rational, logical thought. And how we've got into the irrational, illogical treatments of TMD by treating symptoms, which is one of the symptoms is muscle tightness of various muscles of mastication, muscles of the neck, muscles of the upper shoulder girdle, the strap muscles along the side of the neck, squeezing the brachial plexus, causing arm, hand, finger tingling and numbness. The profession is replete with attempts to treat the symptoms and not the cause. I don't know how more specific I can be, more direct I can be. It's irrational. It's illogical. I reviewed a course that recently actually the course has not occurred yet. The course is proposed and scheduled at a major dental school, of which I'm very familiar, and they are bringing in psychologists and physical therapists to discuss how not only drugs and or surgery, but psychiatric treatment, biofeedback, TENS are all valid treatment for TMD. Well, each one of those, quote, treatments can treat a symptom, no doubt about it. I'm not saying you can't make a symptom go away, but it totally ignores the actual common denominator that creates all the symptoms, which is inflammation within the temporomandibular joint. So the medical profession has got to the point long time ago where once they identify the actual cause in the two examples that I use, and there are hundreds of other examples, the actual cause of the disease or the problem, in this case, inflammation of the pancreas itself, or inflammation and destruction of the islets of Langerhans within the pancreas, causing diabetes. Once that is established, that's the linchpin, that common denominator, then they treat that common denominator by either replacing the insulin in diabetes or just resting the pancreas to allow the inflammation, the generalized inflammation of pancreas to diminish, and the pancreatitis and all of its symptoms go away. Can I be any simpler? If you make this inflammation go away by resting the joint with a protocol, unloading the joint, first of all, with a device, and using a protocol, unloading the joints at first 24/7 to get the best effect, 24/7 except when you eat, and then go nighttime only the rest of your life, you unload the joints sufficiently to decrease the inflammation and make each and every one of the symptoms of TMD diminish and go away. What are those symptoms? Frequent or recurring headache, earache, jaw pain, neck pain, tinnitus, ringing in the ears, subjective hearing loss, feeling like your ears are full of water, vertigo, dizziness, upper back and shoulder pain and tightness, arm, hand, finger tingling and numbness, and obviously various kinds of locking and inability to open. All of those symptoms are subjective, and each responds well to decreasing the inflammation in the joint. Another way of looking at this is nonsteroidal is the use of nonsteroidal anti-inflammatories. Nonsteroidal anti-inflammatories do what? Decrease inflammation. You take a nonsteroidal anti-inflammatory, ibuprofen, Motrin, or aspirin. They will decrease inflammation generally in the body. And if these joints are inflamed, they will also decrease inflammation within the temporomandibular joints. But they run out of steam. They're only good for a couple of weeks. And then the more of the drug you take, the less effective it is. We all know that. We all experience that. If nonsteroidals were the answer, then that's all that would be done. If you had TMD symptoms, you just take nonsteroidals. And people self-medicate nonsteroidals to the point where they damage their kidneys and their liver. That's the situation. That's the current state of the, quote, art of treating TMD within the United States of America and beyond. And frankly, in my estimation, it is irrational. It is not logical to treat symptoms and avoid the cause, inflammation within the temporomandibular joint. Kind of an intense little episode today. I wanted to make this point because I see so many patients, so many patients. I mean, we're talking thousands of patients who have been treated and multiple other methods which are not effective and which are totally irrational. So to get back to the very simple point of this episode, I think we can just wrap it up. And that is, let's take a rational approach, a logical approach to treating TMD, starting with how TMD is defined. So with the definition that I propose, definition of TMD is inflammation within the temporomandibular joint. That is the definition, the simple definition that goes around and is totally inclusive to all of the other symptoms. And trying to define TMD by listing the symptoms would be very similar to trying to define diabetes by listing the symptoms. No, diabetes is the damage to the islets of Langerhans. That's what diabetes is. It's not the symptoms themselves. So temporomandibular joint disorder or disorders is simple inflammation within the temporomandibular joint. I think if you put that out front and look at that simple definition, it'll clarify a lot of the conundrum, a lot of the misunderstanding, confusion, and frankly, craziness that has gone on for decades about treating temporomandibular joint problems. I hope I made this clear. I hope I made it concise. I hope it has some kind of impact on the viewer, on the listener on this episode. So with that being said, we'll just keep it a short episode. If you would like to learn more about the simplicity of treating the temporomandibular joint by unloading the joint according to a protocol, and I had to name it this device that we use, the Urbanic device, patented, FDA approved, university tested, independent university tested. And if you'd like to learn more about how you can apply this very useful and successful technology to your patients that you see in your practice, you can contact me at tony@urbanictmj.com, our Director of Marketing and Education, Dr. Naomi Williams at urbanictmj.com. Our website is www.urbanictmj.com. If you want to learn more, give us a jingle on the website. Contact us by email. Be happy to discuss it with you and sort out this problem for you and your patients, which I see no any limit to the amount of confusion that's going on out there unless the profession itself takes a good hard look, starting with what is the definition of TMD. So for today, I am Tony Urbanic, and this is TMD Demystified. I look forward to the next time that we can visit.